Dr. Viswachandra. I'm a endodontist by profession and consultant at Medicover's Dental Wing. Probably I would like to speak a few words on the importance of gum disease, the management of gum disease in a dental setting and its overall ramifications on systemic health. What is gum health? Most of the patients and even specialists sometimes are very aware of the common dental problems, dental caries being one of them. Something that is generally missed by most patients themselves is gum disease. Gum disease or periodontitis is something that is a painless condition. Now, by the virtue of it being painless, most of the times patients don't seek treatment at all unless it comes to a stage where the teeth may be mobile or where it can lead to severe abscesses and can also have a lot of effects on the patient's systemic health. What we generally do at Medicover's Dental Wing for gum disease is a variety of treatments. There are a lot of treatments in work. We start off with basic periodontal treatments such as scaling and root pairing, which is a very fancy term for getting your teeth professionally clean. At the same time, we also do advanced surgical treatments, and even if it goes to a stage where the teeth cannot be salvaged, we also extract the tooth and actually can place an implant in that specific site. Keeping the normal treatment of periodontitis or gum disease aside, the most important thing that is missed by most of the dental practitioners themselves, and sometimes even by patients most of the times, is the general effect that gum disease can actually have on a patient's body health. For example, it's a very well-known fact that gum disease has a huge association with diabetes. Even uncontrolled gum disease can actually predispose or can make a person susceptible to diabetes. In a diabetic subject, it's very, very important that gum disease is under control because any infection in the gum per se, most of the times, is almost equivalent to actually having a very big ulcer on a patient's hand. So it's very easy to understand what can happen if gum disease is not under control. If the gum disease is not under control, let's imagine something like a huge ulcer in your entire mouth, and that can actually lead to worsening of the symptoms in diabetes. This is something that is known by diabetologists themselves, by physicians themselves. So nowadays, especially the treatment of diabetes also includes a comprehensive oral examination where gum disease must be ruled out. Otherwise, the importance of controlling gum disease, especially in diabetics, is almost understated sometimes, but it's something that is very, very important as controlling diabetes in itself. At the same time, it should not be forgotten that it also has gum disease, uncontrolled gum disease that is, can impact the status of the fetus, especially in pregnant women. So nowadays, most hospitals actually, they suggest that pregnant women actually undergo, basic checkups at least once every 3 months, at least one checkup every trimester, so that, the fetus is not affected. It's very well-known fact that gum disease can actually lead to preterm labor as well as can also lead to low birth weight in most of the pregnant subjects. At the same time, it's also very, very important that other conditions such as respiratory diseases, even rheumatoid arthritis, some people even say polycystic ovarian disease are also manipulated by the presence of this gum disease. So we always say that mouth is actually an index of the entire body, and this fact is probably very much emphasized by the presence or absence of gum disease. If there's no gum disease, most of the times patients can retain all their tooth. It can support a variety of processes. At the same time, their general body health can also be very, very satisfactory. At the same time, if the vice versa happens, it's a very unfortunate situation where the patient must have to seek a lot of high-level treatments, and so that is something that is generally performed. Every gum treatment for that matter, is performed at Medicover Hospitals. And thank you so much.